Equity Mate.
I will say this about investing. Everything you do learn is cumulative. What I learned at 20 is useful.
Welcome to Equity Mates Investing, the podcast where we explore what's possible in the world of investing. My name is Bryce, and today we have an uncovered episode where we unpack a company that doesn't get as much analyst attention. To chat through it all, as always, is my equity buddy, Ren. How are you?
Bryce, I'm good. I'm very excited for this episode, our first uncovered episode for 2024, and God, is it a fascinating company.
Yeah.
The company that we're looking at today is Emyria. The ASX ticker is EMD.
Yeah.
I'd never heard about this company before until we started looking at it for this episode. It is on the cutting edge of psychedelic-assisted therapies, bringing new forms of therapy. They were working on CBD, so from marijuana when it was first rescheduled and allowed in Australia, and now they're looking at other therapies like MDMA therapy, psilocybin therapy. Fascinating.
Yeah. What I found interesting and a bit of a light bulb moment for me during this interview, and this is probably going to sound quite dumb, but whenever I've thought about these therapies, I've always thought of them as just you take the psychedelic and kind of, it just helps alleviate and whatnot. But I didn't kind of put the two and two together that you take it and then have an intense therapy session. I thought it was just like you microdose and over time you just kind of loosen up a bit. Well, and I know this sounds disingenuous, or whatever, but like
no. It's fair enough. I'm sure.
And so the other half of it for me is now like it's the cutting edge of psychedelic assisted therapy, but the therapies, the quality of the therapists and whatnot is such a big part of this as well.
Well, and I imagine even just the availability.
It's like, so anyway, a bit of a light bulb moment for me.
Well, luckily
really enjoyed it.
Luckily it's not Bryce and I that will be taking you through this company. We're actually going to be joined by Michael Winlo, who's the Managing Director of Emyria, and he's going to take us through both what's happening with the company itself, but then more broadly what's happening with the research into these therapies and the legal and regulatory status of these therapies in Australia and what's happening around the world as well. So a really fascinating, both company deep dive and industry deep dive. Now, before we get to Michael, just a quick reminder that the Equity Mates community survey is live. It's your chance to help shape the future of Equity Mates and win $500 doing it. We want to know what you like, what you don't like, what you want to hear more of, what you think we should stop.
Yeah.
If you enjoy these uncovered episodes, if you want to hear more of a different type of content, if you have a particular company you want us to look at for uncovered, the community survey is your chance to have your voice heard. It really does help shape the direction of our content. It led to the change in our content schedule for 2024.
Yeah.
So the link is in the show notes. It would be a great help if you could spend the time to fill it out.
Nice. Well, this is also not a buy, hold, or sell recommendation, and any information on this show is for entertainment and education purposes only. Any advice is general. But Ren, with that said, let's bring in Michael and hear about Emyria. Well, Michael, welcome to Equity Mates.
It's great to be here. Yeah, good to see you guys.
So the majority of our audience will know of the drugs that we're talking about today, but not in the context that we're discussing them. So can you introduce us to psychedelic-assisted therapies?
Absolutely. Let's not make any assumptions about your audience's experience here. Yeah.
We're not sure if they'll be personally familiar with, but they would have heard about them.
Yeah, they would have heard. Yeah, definitely. Yes, they're obviously provocative drugs. What we're talking about here is loosely referred to as the psychedelic medications, but they go by other names in the street as well as they've been outlawed drugs for many decades. So we're referring to MDMA, or otherwise known as ecstasy, although there are some really important differences between the medical grade MDMA that we use in our therapy settings versus that which you might obtain on the street, which is often mislabeled as MDMA, often cut with other drugs. So short public service announcement there. Don't get your medicine. The other compound here we talk about is psilocybin, which is the active hallucinogenic compound in magic mushrooms, which is I guess, the other street name here. And so loosely we talk about these as psychedelic drugs, psychedelic meaning kind of mind manifesting, kind of it was a word coined in the 60s for these kinds of drugs that have very profound changes of consciousness and awareness. They can create hallucinations, which is distortions of reality. That's typically with drugs like psilocybin. MDMA, however, even though it does get classed as a psychedelic, is not a traditional psychedelic in that it doesn't create distortions of reality or changes of perception. One remains pretty lucid on MDMA, but you get these very, very strong feelings of compassion, connectedness to others. There's euphoria associated with MDMA as well, decreased defensiveness. And these qualities of these drugs, they're very unique, they're very potent, and they're starting to capture the attention of the medical community because they're being used in these therapeutic contexts where we leverage these profound changes of mental state to support psychotherapy with patients with severe mental health illness. And that's where these drugs are starting to, I guess, see a comeback and we're starting to see some really profound and positive shifts.
We're really looking forward to getting into some of that research and where psychedelic-assisted therapies are being shown to have an effect. Before we do, we'd love to take a step back and just ask a little bit about your story, I guess, and the story of Emyria. How did you come to work in this area, and what was Emyria's founding story?
Yeah. So I was trained as a medical doctor and worked for a few years as a clinician. I come from a medical family where my father's a doctor, has been a GP out in the country, and saw some pretty wild medicine out here in the West, in the rural West Australia. And so I was always really drawn to healthcare. That was always going to be my focus of my career. But I guess early on, I started to see opportunities for the impact that entrepreneurship and innovation could have in healthcare. So it wasn't about directly treating patients, but about coming up with innovations or new ways of doing things. And so that took me on a journey through some startups. Eventually, I completed my MBA in the US, and I stayed in America. I joined a healthcare company on the tech side of things, a company called Palantir, which is a big data company. They had a very, very small healthcare team. In fact, we were the founding 5 team when I joined. That's now a big part of their business. But that really gave me a deep appreciation for the impact that clinical data can have in helping complex business challenges, particularly in healthcare across drug development and care delivery. Eventually, I returned back to Australia into the CEO role of a clinical trial organization, a not-for-profit here in Perth that does a lot of phase 1 trials in cancer and in healthy volunteer studies as well. And it was there that I started to intersect my career journey together in a more neat fashion, where suddenly the data side of things made real sense. We started to digitize what we're doing on the trial side. Obviously, in trial land, your product is clinical data. In healthcare service delivery, what you're striving for is good clinical outcomes, but you're not paying a huge amount of attention to getting good data. It's about service delivery. And the Emyria journey was really trying to bridge those two worlds to say, well, in healthcare, we do a great job caring for patients, but we don't do a great job learning about the experience of every patient. Over in clinical trial land, we do a great job collecting data for patients, but we're not really making our goal to get these patients better. We're trying to answer a question, perform some research. And so Emyria's mission was really to sit in between those worlds, where we have clinical services, where we're actually inviting every patient to be part of an ongoing clinical study, for want of a better word, where we're collecting rich data on these patients. We're paying attention to many different things, and we're getting educated and we're getting knowledge about what's working and what's not working. And this is the perfect forum for evaluating promising new treatments that appear to have a big role to play, but for which the evidence is lacking. And so we saw an opportunity to really set up a service for recently rescheduled medications. And our first forum was for the medicinal cannabis products that came out. And of course, more recently, we've been preparing for this rescheduling of the psychedelic-assisted medications as well, for the same question, for the same reason.
And so what was the response from the likes of friends and family, even the ASX, potential investors, when you started going out to pitch the idea of working on, building a company that is sort of centered around psychedelic-assisted therapies?
Yeah, caution from both groups, and some raised eyebrows. I mean, the person I most, I guess, wanted the opinion of was my father, being this mainstream established, clinician. But he'd been in the system long enough and seen enough to have just a broad sort of, skepticism about, traditional medicine anyway. Obviously, particularly on the mental health side, we haven't seen a huge amount of progress. So, anything that looked potentially promising seemed right to him. And of course, we were trying to learn what was working and what wasn't, and that was always our bias. And so I think we had credibility from that approach. So he was supportive, and so I think with him, his encouragement didn't really matter what anyone else was saying on the other side. The ASX were, I guess, also suitably cautious. They wanted to see real evidence of a real business. This couldn't just be an idea on paper. So that's we had to go ahead and set up clinics and start treating patients and hiring doctors and show that we were a real service first. So we did that, and that got us through the door, and then we were able to list right before COVID, which made things interesting. But we've persevered and on doing great work at the moment.
So Emyria was founded in late 2018, listed, as you said, just before COVID in 2020, and now we're in 2024. So it's been 5 or 6 years. And in that time, there's been some pretty incredible research on psychedelic-assisted therapies. So can you take us through what some of the last few years has brought us in terms of studies and new research, and I guess where we are now in terms of understanding this whole new category of medicine?
Yeah. Look, we're on the precipice of a really revolutionary new shift, I believe. And Australia, in many ways, is leading the world with the recent, very key decision to reschedule psilocybin and MDMA to allow these compounds to be prescribed medications by suitably qualified psychiatrists for treatment-resistant depression and post-traumatic stress disorder, respectively. Major regulators reevaluate their position on these drugs. These were previously illegal, outlawed, medications. You would go to jail if you touched them or sold them in any way. And now, what a shift that these are now being recognized as having therapeutic potential and being rescheduled. And so regulators will do this from time to time with different drugs if they can be convinced that there is a therapeutic benefit for these drugs. And so we actually have drugs like cocaine in Schedule 8 and ketamine and ibogaine sitting as controlled medications where, as long as they're in the hands of the appropriately trained and qualified specialists and given to patients with the right screening in place, there is a role for these drugs. And so regulators are making these shifts on the back of great evidence that's been presented around the world. And probably the two most well-studied compounds, of course, MDMA for PTSD, which has now gone through 2 phase 3 trials. A phase 3 trial is the gold standard, clinical trial. It's multi-site, it's lots of patients, it's placebo-controlled as much as you can with these drugs. And what we saw, repeated on 2 separate studies was this profound, improvement in symptoms for patients with PTSD. More than 2/3 of patients effectively going into a remission from their condition. And from the earlier phase 2 studies, the durability appears to last at least for 12 months. That's a very, very compelling outcome, particularly in the background of a rising, problem where the current treatments, have an efficacy rate of, 50% or so for most patients. So huge amount of interest and excitement to see whether we can translate those clinical results into real practice. Psilocybin is probably, as just a step behind. It's done some really great phase 2 trials. It's going into phase 3. And after a single dose with supportive psychotherapy, we're seeing 50% improvement in depression scores for patients with severe treatment-resistant depression, which is great. And that appears to last out to 12 weeks after just a single dose. So some important shifts are happening in these patients, facilitated by the medication and the support of psychotherapy. And so now there's a huge amount of confidence. If those results can continue to be revealed, then these drugs will naturally make their way through to approvals. I feel that's inevitable. And then they'll become part of the toolkit of most clinicians. And then the big question will be, well, how do we deliver these drugs into our health system? And then what comes next? And that's part of the question that we're really focused on.
When we were researching for this interview, it's just a whole world that I wasn't really aware of. Let's drill down on PTSD, post-traumatic stress disorder, because I think that really illustrates where some of these therapies are really emerging. And speaking personally, I had no idea about one, the scale of the challenge with PTSD, and two, I guess, the challenge with finding effective treatment. So I think, for people who are listening to this interview skeptically about the use cases for these new therapies, I think it's a good illustration of something. So let's start with just the scale of the challenge of PTSD. How widespread is it? How common is PTSD?
I guess it might be helpful to start with just a simple definition. PTSD, post-traumatic stress disorder, is this chronic, debilitating, mental health challenge where you've got symptoms of restlessness, hypersensitivity, agitation. It's an anxiety type condition that can arise either after exposure to a single traumatic event, or perhaps chronic exposure to, certain circumstances of neglect or chronic abuse. And so one just has this heightened fear response that for most of us we can manage, but for patients with PTSD, they're very activated. They're kind of on edge all the time. And it actually affects up to 6% of the adult population. And that number means that we have nearly 1 million individuals with PTSD in Australia, or 30 million plus in the US, for example. So it actually affects a huge number of people. Obviously, a much higher incidence in first responders and policemen, ambulance officers, firemen, people who go forward when the rest of us go back, and obviously servicemen as well. And it has a reasonably high rate of treatment resistant. There's no single drug that's approved for PTSD, so you have to manage the symptoms. You give people antidepressants, you put them through cognitive behavioral therapy. And so for some numbers, about 50% of patients don't typically get a great response from their standard therapy. And so you're now talking about 500,000 people with a condition that that's affecting their lives in a negative way, not just for the individual, but these people can often not hold a job, or they become an imposition to their family and friends as well. So the psychosocial burden is actually quite significant.
Yeah, that challenge of finding effective treatments and only all of those treatments together only being effective for 50% of the patients is pretty astonishing. Certainly not something I was aware of. So then I guess in comes these psychedelic-assisted therapies, and we've seen a number of clinical trials. Correct me if I'm wrong, but a lot of them coming out of the US.
That's right. Yeah.
Let's focus on the stage 3 trials. What have we learnt from those trials? And most importantly, I guess, how have the results from those trials compared to the common treatments that are available today?
Yeah. So we've learned a couple of things. I guess we haven't yet had a chance to describe how it is that these treatments are typically taken or administered. And that's kind of really important here as well, in that the emphasis, we're excited about the drugs because they are these, because of their history, because of what they do. But the qualities that make these drugs, attractive party drugs, actually make them really powerful adjuncts for psychotherapy. So MDMA's case, it has this really unique feature of dramatically increasing release of serotonin, which is connected to feelings of trust and connectedness with each other. It releases dopamine, which is compound neurotransmitter related to euphoria and feeling good, and then noradrenaline, which is that activation compound involved in fight or flight. So that's why you got the energy with MDMA. But these qualities in the context of psychotherapy allow a patient to work through really challenging material in a much more calm state of mind, with less of the fear response, with less defensiveness. They can be a bit more compassionate to themselves, to the circumstances, and it allows the psychotherapy to be really effectively unsticking these patients in the therapy context. And so it's really important that this is intensive psychotherapy, up to 6 to 8 hours in a single dosing session, where the medication is really opening up the content and helping the individual work through their issues. So for MDMA, how this has worked is people have a preparation session with their therapist, and they set an intention. They have these long dosing sessions where they're in the presence of 2 therapists for 6 to 8 hours. They have some follow-up integration sessions, we call them, with the therapist, where they work through the content of those intense dosing sessions. And the studies have shown that 3 dosing sessions with those intervening preparations and integrations can lead to this incredible outcome where 2/3 of patients have a full remission and 80% will have a clinically significant improvement in their symptoms. And so we've learned a couple of things. We've learned that that you can't do, that the psychotherapy appears very important. that the drugs are there to facilitate psychotherapy, that it's important to I guess, give psychotherapy its prominence in this therapeutic modality. But we're learning that the safety is exceptional. Certainly, if you screen patients carefully, there are some exclusions for MDMA. Cardiovascular issues need to be looked at, and ideally, we're not taking people with psychosis as well. So there are some exclusions, but generally, the patients is very, very well tolerated. Very few adverse events for those who are carefully screened, and remarkable progress through therapy. Psilocybin is a little bit different in that it's usually a single dose. You have an intensive hallucinogenic experience at the doses which appear therapeutic. You lose sense of self and time and place, and so the content is a lot more abstract. And so the therapist really there to keep you safe in those dosing sessions, and then work through any sort of key insights that you may have in the following days through the integration work as well. So we're learning this is a really different way of doing therapy. Appears very effective and very safe. And so now the big questions are, well, how can we deliver this, in a real world setting? And how can we make it affordable and scalable? Because, a key thing that we think about, it's one thing to do a single session. It's one thing to build the prototype. It's another thing to build the factory that can make your innovation scale. And so it's one thing to do one session, but how do we do 1,000 sessions? How do we do 10,000? And that's something that we think we pay a lot of attention to.
What, if any, have been some of the side effects from those sessions, and what's the intensity or the cadence in which you could do 2 or 3 6 to 8 hour sessions of the MDMA?
Yeah, so we normally, for a single patient, cadence, if you're talking about how frequently we'd have somebody go through a dosing session, the phase 3 trials typically space them out about a month apart.
Okay. But
there's some evidence that anywhere between 2 to 4 weeks is probably adequate, and it may be different for different people. You need to give individuals time for the window of opportunity to open up. There are changes that take place in the brain. There's an increased plasticity, which appears to be in effect for at least 7 days after both MDMA and psilocybin. And so you've got some real opportunity to try and learn new behaviors and develop new habits and put to action some of the the insights that you might have learned or had through the dosing session. So it's important to space them out. You wouldn't whack them all together a day, but one after the other. Psilocybin sessions can be challenging for people. It's not necessarily going to be a happy time, and so if patients aren't in a rush to go back into that headspace. And so again, most of the studies have just evaluated a single dose, but there may be some models where people are having 2 doses, again, probably spaced out about a month. But this isn't a drug that you take every day. This isn't a drug that you have, multiple days per week. These are intense sessions that we space apart, give the mind a chance to breathe, people to work with the content that they've surfaced. The ultimate outcome here is for people to adopt a new way of thinking about themselves and the world, and hopefully adopt more positive and worthwhile behaviors.
Yeah, nice. So let's turn to Emyria's future. And with the Australian government rescheduling psychedelic-assisted therapies as controlled medicines, this has obviously opened the door for companies like Emyria. So how have you responded? How are you, taking this opportunity? Yeah.
So we've been preparing for this for a while. We've had experience with rescheduled drugs, with the with the cannabinoids. A majority of our patients have always been mental health patients. We have done a couple of things. We've broadened our clinical service footprint. So we now have a psychological trauma care focused clinical service with specialists, psychiatrists, supportive counselors, therapists, social workers, occupational health therapists as well, mental health nurses. We have a really, really broad team. And integrating that with our Emerald Clinic service, which has been GP-led, we now have these mental health GPs as well. So we really have the full spectrum of care. We think that's really important for providing these therapies. We've got the full wraparound kind of services to support these patients before, during, and after, which is really important. So we're very much on the front line of delivering these therapies. We have all of the regulatory approvals in place, and we've also secured the drug supply, which was quite challenging. You don't go to your corner man for these medications. You have to go to special qualified, pharmaceutical grade manufacturers of these treatments. And so we have all of that in place, as well as a trained team. We've been running clinical trials for some months now, so we have a lot of hands-on experience in how to move these patients through, how to select them, and obviously what it's like to provide the care for them. So we think about two really important things. This is drug-assisted therapy. So the future is going to be, advancements in the drug development side. MDMA and psilocybin won't be the last psychedelic drugs that have a role to play here. There'll be improvements. We'll be looking at things. Can we shorten the sessions? Can we improve the safety profile and broaden the patient population who are eligible for these treatments? So we're really interested in drug innovation. We have a program in that field with the University of Western Australia here. We're looking at making changes to MDMA to see whether we can create some of these different applications. And we're also interested in the therapy side. So we know that the hands-on is hard. This is a very expensive, intensive type of clinical intervention, interventional psychiatry. People in psychiatry aren't accustomed to this. Therapists and psychiatrists don't typically cohabitate in the same clinic. That's actually unusual. And so how do we create a space where these individuals can work together and that we can support facilitation of this? And so I think there's going to be a lot of innovation in the care delivery side as well. And we think about making adjustments to the way we deliver this so that it can scale, can be more cost effective. And so, people, challenge us for being involved in both of these worlds. But then the pushback is, well, this is the future. It is drug assisted therapy. And we see opportunities to innovate along both dimensions.
It's so fascinating, and there's so many follow-ups I want to ask around the health side of it and the drug development side of it. But I'm mindful of the time, and I am mindful that we are an investing podcast here. So let's move to the financial side of it. When it's such an early stage of the market, just being rescheduled and just sort of developing, I imagine it can be quite hard to forecast accurately about what's to come. So I think, as a company leader now, how do you think about the economics of the market, but probably more importantly, the economics of your business? What are the financial metrics you're watching the most closely, and how are you sort of assessing health and success financially at this stage?
Yeah. Look, I think at the foundation, there's a fairly simple business. We've got to be a really excellent clinical service organization. We already, generate, revenues, around $1 million a year from the clinical services. That's before we've actually implemented anything new like the MDMA-assisted therapy. And so we think about, well, how do we do this really efficiently? How do we make the best use of our staff and team and clinicians? And how do we, implement a service that can cover its costs? The truth is that this intervention needs to work well for the clinicians. They need to not lose money. They can't go backwards. As much as we'd love them just to donate their time, to bring the cost down, that's not going to happen at scale. So we need to find a way that they can get paid well to do this treatment. But we believe in the efficacy so much that if we can replay the results, the cost effectiveness is there. And now we have the winning combination, something that's better for patients, that works for clinicians, that actually delivers really important health economics benefits to the economy, to society. So we're focused on setting up our clinics in a way that allows us to get the throughput to a point where we can actually do this profitably and safely, deliver great impact, have a repeatable model that we can pick up and take elsewhere, either through our own linear growth, or we can work with partners to get this going. If we can pay attention to what's happening with patients, track those outcomes, we're going to be in a really strong position to negotiate with payers and get adequate coverage for this treatment as well. Because I'll throw some other numbers at you. The average hospital admission in WA here is $2,200 a night, and the average stay is about 19 days. So very quickly, you're suddenly much more expensive than a psychedelic-assisted therapy treatment. And these patients, they don't necessarily get better after their 19 days in hospital. They're just burnt out, or we've contained the crisis. They go back to the community until they are readmitted. So the current health system dynamic is, particularly for mental health, is imperfect. And so I don't think it'll take much for us to demonstrate, the cost effectiveness of these treatments. And even though it's a new way of sort of paying for care, it's a new way of thinking about mental health sort of interventions, I think the payers will be compelled and will engage. And then that obviously suddenly unlocks massive economic potential for those services who are ready and prepared to scale and grow into that demand.
Yeah, healthcare is always an interesting market because the player that is paying for the service often isn't the player that is receiving the service. And so you've got a few different people that you've got to convince. How have the conversations with health insurance companies gone? Have they even started, or is it too early in the process to...
Yeah, they absolutely have started. In fact, healthcare is more broken than that. Usually a market dynamic, you got the buyer and the seller. But in healthcare, you got three people. The decision maker doesn't pay, that's the doctor. The payer doesn't benefit, that's the health payer. And the patient who benefits doesn't pay or decide. And so the market dynamics do not work here. So you need to engage all three groups. So you clearly need to be, as I mentioned, better for patients. You need to have really good data to engage the clinicians and give them a place they can come and practice this. There is no shortage of therapists and psychiatrists who want to get involved. They are frustrated with outcomes. It's a really stressful job being in psychiatry. So it's not uncommon for a psychiatrist really to get to about 500 patients and then close their books and then not and then they're busy enough with those 500. And so, but we need many more than that. We've only got 4,500 private psychiatrists in Australia, but there's hundreds of thousands of patients who need better care. So we create the conditions to allow those specialists and therapists to come and work. And then the payer conversations have started. They are clearly looking on the outside in. So it's up to organizations like us to demonstrate that we can get close to the efficacy we've seen in those phase 3 trials. But they are driven by economics at the end of the day. And with a $50,000 hospital admission or a $30,000 treatment, or for that patient where everything has been tried and you've thrown the kitchen sink at them and they're still not getting better, then you almost have a moral obligation to try the next thing. And so I think we're going to see engagement from the payers. We will. And I think that's inevitable. And it's just a matter of demonstrating that we as an organization have a consistent, repeatable, care model that they can get behind to fund.
Well, Michael, if you think about Emyria in 10 years' time, what does success look like?
Yeah, I love that thought experiment because 10 years is quite a way into the future. A lot can change, and certainly didn't see the rescheduling of psychedelics coming. But look, I would love if we were, we had a network of clinical services around Australia, potentially around the world. We sort of networked, partnered, cooperating to advance mental health treatment and be an engine for innovation, a place where the very best new possible treatments are being evaluated alongside the gold standard of care. We have parables like this in cancer, where the latest, best promising treatment is being put up against the current gold standard. I can see that happening in mental health as well. And I think that's going to be new ways of working with patients and also new drug treatments. And we want to be that center of excellence, that engine of innovation that kind of sets the precedent for how things could look for others.
Love it, Michael. Well, the scale of the challenge is big. Mental health is, it's front of mind for people, but it's been, decades of understudied and underinvested. And we're excited to, see what comes next on the journey and what new drugs come down the line. So all the best with it. Good luck. And we'll be watching from afar.
I appreciate your time today. Thanks for your questions.
Thanks, Michael.
You have been listening to an Equity Mates Media production. In the spirit of reconciliation, Equity Mates Media acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respects to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. This podcast is intended for education and entertainment purposes. Any advice is general advice only and has not taken into account your personal financial circumstances, needs, or objectives. Before acting on general advice, you should consider if it is relevant to your needs and read the relevant product disclosure statement. And if you're unsure, please speak to a financial professional. The hosts of this podcast and their guests may have positions in the companies mentioned. Equity Mates Media operates under an Australian Financial Services Licence 540697.